Today, we are going to discuss a very interesting repair hair transplant case of a 50-year-old patient who had come to us from UK after getting his 3 or 4 previous hair transplants from different places in the world. So let us begin this interesting discussion. These are his top and the front views before and after. So the problem here which he wanted to correct were very specific. The previously generated hairline was unnatural, thin, and his temple points hairs were standing out. Generally, the temple hairs are very flat, but from his side views, those hairs were standing at a degree or at an angle which looked very unnatural to him. This was the wanted correction or the desired correction in this case. Filling up the front, making the hairline natural, and doing the temple point correction by extracting the grafts. So here is Mr. Alexander, a 50-year-old male wanting corrections in his front and the top view. When we did his trichoscopy and dermoscopy, we could see that there were some small patches or his skin was a bit different from normal skin. And we did a biopsy as the first step for him. And we told him that your skin looks a bit different. We will take a biopsy for you if you wish so. And he very much wanted to do so because he has already mentioned undergone 4 hair transplants. The cumulative cost of those transplants was, as per him, more than $100,000 in different places in the world like UK, Turkey, and a very celebrity hair transplant doctor in California, USA as well. So we told him that we would like to do the biopsy so that if something comes out, we can do some course correction in his medical management. And he very much agreed for that. And then we started doing his trichoscopy. Here we can see that there are a lot of visible patches in the scalp, which means his donor site is quite thinned out up to here. So we selected a small area in his donor site, which was well within the safe donor area, and we wanted to use this as the safe donor area. So we did his trichoscopy here. His donor hair's average thickness was 0.067 millimeter, which we believe is slightly on the lower side. As you can see, because of previous multiple hair transplant, his donor site density is quite less. And you can see our other hair transplant videos, which show that a good density is what we consider about 80 follicular units of graft per centimeter square. So in his case, the density or the donor density was 61 grafts per centimeter square. Average number of hairs per follicle was also on the lower side. Coverage value was also quite low. So considering this point that the donor site is not very good, we calculated his total donor area. It was around 154 centimeters square. We thought that probably we can take out small number of grafts in the donor area. And we calculated that we can take out around 1540 grafts. And some grafts we planned, we mapped the temple points also, and we found out that we can take out around 150 to 160 grafts from the temple points. So we had in our hands around 1700 follicular units of graft in this case. So as we know, hairline designing is very crucial part, and sometimes people do come to us for the hairline correction only. A natural hairline should look age appropriate. Even if you age, it should look appropriate. It should be soft in the front, and hairline should be irregularly irregular. Real hairlines are not straight. Very important. And it should account for potential future hair loss also. So in his case, we wanted to fill up this area and do some extractions of these hairs which are lying below the marked hairline or the irregular hairline. You can see there are some soft hairs here as well. These needed to be extracted, and these hairs which were there in this temple point, they were quite unnatural. So we wanted to remove them. You can see that they are coming out at an angle here and looking very unnatural. So these hairs also need to be taken out. So what we did was, we did not do a complete shaving in his case because it would have taken a lot of time for him to get the same kind of hairs back. So no complete head shaving was done. Selective donor site trimming was done, sort of a non-shaven hair transplant, and immediately post-transplant his hairs look natural. This non-shaven technique is good when a small session is planned and a person having a lot of other hairs, the nearby hairs are quite long, which can camouflage the transplanted area. But it needs a surgical precision. Magnification has to be accurate. We should not transact or damage the existing hairs. So it has a limited application. We found that in his case, this can work. The area which we chose to cover was around 53 centimeters square in the front, and we plan to give him a density of around 32 follicular units per centimeter square, thereby calculating the requirement to 1700 grafts approximately. A word about PeekAI feature in Saraswat Hospital App. It gives you a natural AI transformation along with the number of grafts required. Just a simple 3-step: download the app, fill the questions, take the pictures, and just wait for your results, which are approved by the ABHRS doctors. So the complete plan or the surgery after getting all the blood tests, doing the small biopsy, was local anesthesia, extraction of the grafts by not shaving the entire scalp completely, sort of a non-shaven FUE. Slit making was a bit time-taking process process in his case, so it took us around 45 minutes to 1 hour because we were trying to prevent any damage to the existing hairs. Extraction took us around 1.5 to 2 hours, then the sorting of the grafts into 1, 2, 3, 4 hair grafts and punching the hairs in the unnatural hairs in front of the hairline and the temple points. Implantation took us around 2.5 to 3 hours, so the entire procedure was around 6 to 7 hours with a few breaks in between. So on day 3, we did his shampoo, a very soft and gentle shampoo which was told to him, also demonstrated to him on a video, like how you have to do in the future next 7 to 10 days. Here the grafts which are extracted, we can see the red dots at day 3, and this is the transplanted zone, and this is the area from where the grafts have been extracted. So he underwent another facial rejuvenation procedure, anti-aging HIFU, which is a daycare or an office procedure, just takes around 1.5 to 2 hours and gives pretty good results in selected patients. This is him at day 10 when he shared his pictures with us. The marks are fading. The grafts which have taken out, it's looking well settled. The scar is barely visible at day 10 from the areas where the grafts have been taken out. This is him at day 12. This is day 23. And finally, these marks are even less visible. We can see hardly visible scars here of the extracted grafts. Day 34, even better, well settled. And with the long hair, you can see that with precise slit making, there is hardly any shock loss of the existing hairs. He looks as if he has not lost his hairs after the transplant. Whenever the slit making is done with the long hair, in between the long hairs, sometimes there can be a severe shock loss of the existing hairs as well, which has not happened in this case. And then this is at 1 year. You can see that the hairline has started looking much better. Our hairs are looking much more fuller, and these hairs, when kept long and combed backwards, that is covering the scalp in the mid-scalp region as well. You can see that there are few unnatural hairs which are still existing in the temple point. This is because not all the hairs are in growing phase. Some of the hairs are in the sleeping phase, which must have come out after the extraction of the grafts which were placed at weird angle. So this may need another session to take these grafts also out. And this is a short testimonial which he gave to us, and we have made video about this. So let us see what he says.
Ladies and gentlemen, my name is Mr. Alexander, originally born in England. I would just like to share my experience of this wonderful place. But first, I'll tell you a bit of a history about myself. I've been suffering from hair loss for many years. And in 2010, there was a famous clinic in Harley Street called Harley Street Hair Centre. Wayne Rooney, a famous footballer, he went and he done his hair over there. And there was a very big hype. I immediately went there. I had my first hair transplant of 2,300 grafts in 2011. It was okay. After 6 months, they pushed me again to do another one. So I done another one in 2012. I was not advised no medication, no pills, and the hair was gradually starting to fall down, bit by bit. I got very frustrated, and after 4 years, I had another one done by them. They claim to have the best doctors in the world, but the only mistake I made that I didn't realize that they only had technicians. So of course, after the third time, it failed again. I was heartbroken at the time, and in 2018, I went to a very famous doctor in Los Angeles who implanted me 5,600 grafts over a period of 3 days, starting from 9 o'clock in the morning till 8 o'clock at night. Was a lot of pain. Unfortunately, over-harvested my back, and the grafts, instead of coming out, they were all lost one by one. Also a very traumatizing experience, because you follow the social media and you follow the world, and there's a lot of hype. And it's unfortunately a whole bunch of lies. 3 years ago, I had PRP done by a doctor in Dubai, and he told me the only best surgeon doctor to come is Dr. Satya Saraswat. I'm just here now. I've got to say, I've had about nearly 2,000 grafts done. No pain whatsoever. I am very pleased. The service was absolutely immaculate. I'm going to recommend this Dr. Satya and his wife and the whole team here to the whole world. And I think if anyone wants a hair transplant, they shouldn't waste their time anywhere in the world. This is the place to come. And I'll give you another update in like 3-4 months time as the hair starts to grow. I will give like every 3 months. I will share, and I hope this is the last time, and God bless you all. Thank you.
So we can see that 1 year transformation is something sort of not exactly a fail, but a unnatural results. We improved the look of the scalp in the front and the top. By the way, his biopsy came out to be a rare skin disorder known as pseudopelade of Broke. The results came to us at around 10 to 15 days post procedure, and we advised him some treatment for that. That improved his overall skin health as well. And the hair density also, we can see that it has improved after the transplant. If you want to know more about the cost of hair transplant, please click the video on the left. And if you want to see some more results of our grade 3 hair transplant patient, please click the video on the right. Thank you.